Can PAE significantly shrink your enlarged prostate? Imagine a treatment that can reduce the size of an enlarged prostate without the need for major surgery. Prostatic artery embolization, or PAE, is a minimally invasive procedure that does just that. It works by blocking the blood flow to the prostate, which causes the tissue to shrink over time. This reduction in size can lead to noticeable improvements in urinary symptoms like difficulty starting urination, weak stream, or frequent trips to the bathroom. Studies have shown that PAE can lead to significant prostate shrinkage, especially in men with very large prostates. For example, some research reports reductions in prostate volume of about 25 to 40% within a few months after the procedure. One study observed a decrease from around 250 cubic centimeters to 151 cubic centimeters 3 months after PAE, along with major improvements in symptoms and urinary flow. This means many men experience better quality of life and easier urination after the treatment. The procedure itself involves inserting a small catheter through a tiny incision, usually in the groin or wrist. The catheter is guided into the arteries supplying the prostate, and tiny particles are injected to block blood flow selectively. Over time, the prostate tissue receives less blood and begins to shrink. Patients often start noticing symptom relief within days, with continued improvement over the following weeks. Compared to traditional surgery like transurethral resection of the prostate, PAE offers several advantages. It is less invasive, meaning no large incisions or general anesthesia are needed. Recovery is quicker, often allowing patients to go home the same day and return to normal activities within a short period. The risks of complications such as incontinence, sexual dysfunction, heavy bleeding, or infections are generally lower with PAE. Long-term success rates are promising, with about 76 to 85% of patients reporting symptom relief up to 6 years after the procedure. However, it is important to note that PAE may be slightly less effective than surgical options like TURP in terms of symptom improvement. Reoperation rates can be higher with PAE, around 20%, compared to about 5 to 6% with TURP. Still, large studies have not reported severe complications, indicating that PAE is a safe option for many men. It is essential to remember that PAE is primarily used for benign prostate enlargement caused by benign prostatic hyperplasia, not for prostate cancer. Because PAE can lower prostate-specific antigen levels, it may influence prostate cancer screening and monitoring. Therefore, discussing this with a healthcare provider is very important. In summary, PAE can significantly shrink an enlarged prostate and improve urinary symptoms safely. It is a good alternative for men who want to avoid more invasive surgery. But every individual situation is different, so consulting with a urologist or interventional radiologist is key to determining if PAE is the right choice based on prostate size, symptoms, and overall health. Always seek personalized medical advice to make the best decision for your prostate health.